Welcome, everyone, to another deep dive. Today, we're peeling back the layers on a market that might fly under the radar, but it's incredibly important. We're talking about the global breast milk pasteurizer market.
Right.
Sounds a bit technical, maybe, but it's really about safe nutrition for the most vulnerable infants,
Okay.
in NICUs and supporting milk banks globally.
Absolutely. It's fundamental.
So, our mission today, let's unpack the trends, the pretty surprising growth figures, actually, and see
Yeah.
what's really driving this essential sector.
And it's fascinating because this market directly impacts infant health outcomes.
Yeah.
The demand for safe donor human milk and neonatal units, well, it's just growing and growing worldwide. It's a real shift.
Definitely.
So the big question is, what's the data actually telling us about where this whole sector is heading? What are the stories behind these numbers?
Okay, let's jump into the big picture then, the global market. So back in 2021, it was valued at roughly $122.9 million.
Hmm.
But here's the interesting part. It's projected to grow quite steadily. We're looking at $145.9 million by 2025, and then climbing up to over $205 million by 2033.
Wow, it's quite a jump.
Yeah, it represents a compound annual growth rate, a CAGR, of about 4.38%. So consistent expansion.
And that growth, it isn't happening in a vacuum. There are some core reasons behind it.
Like what?
Well, first, there's just much greater awareness globally about how vital human milk is for infants. Plus, healthcare infrastructure, especially neonatal care, is improving and expanding in many places.
Right, more NICUs, better facilities.
Exactly. And critically, there's this rising demand for and acceptance of donor human milk. It all points to sort of an evolution in global health priorities focusing on early life.
Makes sense. Okay, so with that global view, let's maybe zoom in a bit. How does it break down regionally? Starting with, say, North America.
Sure.
North America is a really significant chunk of this market. Back in 2021, it was about $43.75 million. And it's forecast to grow steadily, too, reaching almost $51 million in 2025. And then close to 70 million, 69.3 million technically by 2033. That's a CAGR of just under 4%, around 3.9%.
Right. And within North America, the U.S. is, well, it's the dominant force. No real surprise there.
Holds the lion's share.
Definitely. It went from about $37.4 million in 2021 and is projected to hit over $58.4 million by 2033. That's a CAGR of roughly 3.8%. It reflects their, established healthcare system and extensive milk bank networks.
Okay, so the US is the biggest piece. But interestingly, Canada is actually growing a bit faster, isn't it?
Yeah, that's right.
Their CAGR is closer to 4.8%. They're projected to go from about $3.7 million up to nearly $6.5 million by 2033.
A noticeable pickup in pace there.
Yeah. And Mexico's making steady progress, too. Looking at about $2.7 million back in 2021, projected to reach over $4.4 million by 2033. That's growing at over 4.1%. Solid growth across the board, really.
It shows a consistent commitment across the continent, even with different market sizes.
Oh. Okay, let's hop across the Atlantic. What about Europe? How does the picture look there?
Europe's also showing, very solid growth.
Yeah, the numbers look good. It was around $27.2 million in 2021, expected to reach over $31.5 million by 2025, and then hit almost $43 million by 2033.
Right, and the CAGR there is pretty similar to North America overall, about 3.95%.
So consistent growth there too, but Europe's diverse, right? Are there standout countries?
Oh, absolutely.
Mhm.
Germany really emerges as a key market. It's showing strong growth from nearly $5.9 million in 2021. It's expected to reach almost $10 million by 2033.
Wow, really doubling.
Yeah, with a CAGR of about 4.6%.
Right.
That suggests, a really strong integration of donor milk programs there.
And the UK, how are they doing?
The UK is also a strong performer, growing from just under $4 million to over $6.5 million by 2033. Their CAGR is about 4.27%.
Okay, so similar growth rates. What about others? France, Italy?
Yep, they're significant contributors too. By 2033, France is projected around $5 million, Italy near $4.4 million. Spain's interesting, expected to hit about $3.35 million, but growing at the same rate as the UK, that 4.27%.
Huh, interesting parity there.
Yeah, and Sweden's not far behind either, growing at over 4.1%.
Yeah.
So you see pretty widespread adoption, especially in Western Europe, though maybe at slightly different paces.
Right. Are there areas with slower growth then?
Well, Slower is relative, but yes, you see more moderate growth figures in places like Denmark, Switzerland, Russia. They're still growing steadily, contributing.
Right.
It likely reflects, different national healthcare priorities or perhaps just varying stages of milk bank development across the continent. And then you have smaller markets like Luxembourg projected around $300,000 by 2033, showing it's still quite nascent in some areas, still room to grow.
Got it. Okay, now, let's shift gears because the next region, Asia Pacific, well, the numbers here are really something else.
Yeah, this is where things get really dynamic.
It's showing the highest growth rate globally, an impressive 5.3% CAGR overall. It's expanding from about $30.5 million in 2021 to projected over $56.5 million by 2033.
It's a huge leap. And China's really leading the charge within Asia Pacific.
Big numbers there.
Definitely. Growing from around $9.2 million in 2021 to over $17.5 million by 2033. That's a CAGR of nearly 5.5%. It signals a massive investment in advanced neonatal care.
Wow. And then you mentioned India earlier.
Yeah.
Their growth rate is even higher, right?
It is. India actually boasts the highest CAGR in the entire region, a staggering 6.06%.
Over 6%.
Yeah. Climbing from about $4.7 million to over $9.5 million by 2033.
It's not just population. It's clearly reflecting major investments in healthcare and rising standards of care.
That's incredible growth. Who else is contributing significantly in APAC?
Well, you've got other solid contributors looking out to 2033. Japan is projected at over $8 million, South Korea over $6 million, Taiwan nearing $2 million.
Right.
Australia shows more moderate growth, reaching about $2.5 million by 2033, but still steady. And what about some of the smaller dynamic markets there?
That's another key part of the story. Markets like Singapore are growing fast at 5.7% CGR. And Southeast Asia, as a block, even faster, almost 6%, 5.94% CAGR.
So it's broad-based growth across Asia-Pacific, really.
Absolutely. It's clearly emerging as a powerhouse. It shows a strong regional commitment to improving infant health, probably driven by a mix of policy, investment, and parental demand.
Okay, fascinating stuff in APAC. Let's move now to South America. How's the market shaping up there?
South America is another interesting emerging market. It recorded nearly $9.6 million back in 2021.
Right.
And it's set to grow to almost $16.5 million by 2033. That puts its CAGR at a healthy 4.6%.
Solid growth. Who leads the way there?
Brazil is the largest market in the region, growing from $3.7 million to projected over $6.2 million by 2033. It often sets the trend for neonatal care advancements in the region.
Okay. Brazil leads in size, but Argentina seems to have a notably higher growth rate.
That's right. Argentina's CAGR is projected at over 5.1%, 5.18% specifically. It's expected to reach nearly $2.9 million by 2033.
So faster acceleration there.
It suggests a particularly rapid uptake of these pasteurization technologies within their system. Yeah, and we shouldn't forget others like Colombia, Peru, and Chile. They're all active contributors.
Any specifics on, say, Chile?
Yeah, Chile's growing quite robustly, too.
Yeah.
From about $1 million in 2021 to over $1.8 million projected by 2033. That's a 4.8% CAGR, showing widespread regional momentum.
Good to see that broader commitment. Okay, finally, let's round this out with the Middle East and Africa. What are we seeing there?
All right. The Middle East market stood at nearly $7.9 million in 2021.
Okay.
It's projected to grow to over $13.4 million by 2033, reflecting a strong CAGR of over 4.5%.
And any particular hot spots within the Middle East?
Definitely. Turkey shows impressive growth of the KDR around 4.85%, and the UAE is even higher, 5.25% CAGR.
Wow, over 5%.
Yeah, the UAE is projected to grow from about $1.1 million to over $2.1 million. It really highlights that focus on advanced healthcare infrastructure, maybe medical tourism playing a role too.
It makes sense for the UAE. Okay, and what about Africa?
Africa, while starting from a smaller base, is also projected to grow. From about $4 million in 2021 up to nearly $7 million, $6.9 million by 2033.
And the growth rate?
The COGR there is around 3.95%. So steady growth, but obviously a region with, immense potential as healthcare systems continue to develop.
And within Africa, who are the key players?
South Africa is the main market currently, expected to reach almost $3 million by 2033, growing at about 4.5%.
Okay.
Followed by Nigeria, projected to reach nearly $1 million by 2033, with a growth rate over 4.2%.
Mm-hmm.
These are really important indicators of progress in foundational infant healthcare in those nations.
Absolutely. So after looking at all these regions, all these numbers, what's the big takeaway? What should you, our listener, really grasp from this deep dive?
Well, I think
it seems clear the global breast milk pasteurizer market is, well, it's vital and it's growing consistently everywhere. The drivers we talked about, infant health awareness, more NICUs, donor milk acceptance.
Right.
They seem to be universally pushing this forward.
Exactly. And from a strategic viewpoint, that has real implications.
Hmm.
You've got the established, vital markets like North America and Europe continuing their steady growth.
Right.
But then you have the Asia-Pacific region, especially led by China and India, just booming. That signals, really significant new opportunities for investment, for manufacturers, for healthcare providers,
A major growth engine there.
undeniably.
Yeah.
And underlying all of this, as healthcare standards evolve globally, the demand for safety, for hygiene, especially with donor milk, that's only going to intensify. So the need for efficient, reliable pasteurization is just going to keep climbing
Yeah.
everywhere. Developed markets, the emerging markets, all of them. It's becoming indispensable.
Yeah. Indispensable is a good word for it. What's really fascinating to me here is how these market numbers, they don't just show us the state of neonatal care today. They also kind of hint at the global priorities, the innovations that are shaping the health of babies for decades to come.
It's a great way to put it.
So for you listening, what really stands out from all this data? How might these trends influence how you think about global health and the future of infant care? Something to chew on. Okay, let's unpack this. Have you ever stopped to think about what makes a market, maybe one that seems kind of niche, actually foundational? Foundational for global innovation. It's often in these, unexpected corners where we find the most profound advancements, things that are quietly transforming lives.
Right.
Today, we're taking a deep dive into one of those areas, the global breast milk pasteurizer market. Our mission, really, is to pull out the crucial insights, the drivers, the challenges, and the future trends of what is truly a life-saving sector.
And what's truly fascinating here, I think, is how a market that might look highly specialized on the surface is, well, in reality, it's absolutely fundamental. Fundamental to advancements in global neonatal care.
Neonatal care. Okay.
Yeah. This technology has a direct and, frankly, profound impact on some of the most vulnerable populations we have. It ensures both safety and access to vital nutrition.
And when we talk about vital nutrition, especially for newborns, we're thinking donor breast milk, right?
Yeah.
I mean, for a tiny, vulnerable baby, maybe in an NICU,
Exactly, a neonatal intensive care unit.
the impact must be just immeasurable.
It really is.
Yeah.
Donor breast milk offers these unmatched nutritional and immunological benefits,
Yeah.
especially for premature or medically vulnerable newborns in those NICUs.
Right.
But, and this is the key part, for this amazing resource to be truly safe and effective, pasteurization is critical, absolutely critical.
So it's not just about having the milk, it's about making it safe.
Precisely.
Yeah.
It's the specific process needed to eliminate pathogens, the bad stuff, without, compromising those vital nutrients.
Yeah.
Hospitals everywhere, they don't just rely on this technology. They understand these pasteurizers are, well, indispensable tools in pediatric care. They literally enable the safe use of donated milk.
Okay, so indispensable. But here's where it gets really compelling for me. Despite being specialized, you're saying this market is actually seeing significant growth.
Yes, definitely.
What forces are converging here? What's pushing it forward?
Well, there are a few key things. One of the primary drivers is simply the escalating demand from NICUs themselves.
Okay.
As the medical world understands more and more how essential donor milk is for neonatal survival, the investment in proper hospital-grade pasteurizers goes up. It's becoming seen as foundational care, not a nice-to-have.
Not a luxury anymore.
Exactly. Then there's this really significant surge in support for human milk banks globally.
Ah, milk banks, right?
Yeah, these initiatives, often driven by governments or nonprofit healthcare groups, are setting up milk banks specifically to fight infant mortality and malnutrition. And they absolutely rely on high-precision pasteurization systems. It's core to their mission.
So infrastructure is growing.
It is. And this is having a particularly big impact in developing countries, where this kind of infrastructure is maybe just starting to emerge. It's creating some really positive momentum in the market.
So we're talking about building this whole global network for infant health, not just isolated hospitals. That's huge. And I'd imagine that scale needs technology to keep up. How much is innovation in the actual machines driving this?
Oh, a substantial amount. Technological innovation in the pasteurization equipment itself is a major catalyst, absolutely.
Like what kind of tech?
So modern machines now have things like automation, real-time temperature monitoring, digital logging.
Okay, that sounds advanced.
It is, and it matters.
Mm-hmm.
Automation means less manual handling, less room for error. Real-time monitoring ensures the milk is heated exactly right, hot enough to kill pathogens, but not so hot it destroys nutrients. And digital logging. That creates this concrete audit trail, every step recorded. Crucial for safety, for compliance. Precision is everything here.
Peace of mind, really.
Definitely. And we're also seeing newer systems that are more compact, more user-friendly. That boosts efficiency, sure, but it also means they can be adopted more broadly, not just in big hospitals, but maybe in smaller clinics, regional milk banks, even potentially home-based donor programs down the line.
That's fascinating, kind of decentralizing it. But, okay, progress always has bumps in the road. With any growing market, there are hurdles. What are the practical difficulties? What's slowing down getting these life-saving machines everywhere they're needed?
Yeah, there are definitely some significant challenges. The first one's pretty straightforward.
Yeah.
The high cost, both the initial equipment cost and then the ongoing maintenance.
Ah, the money aspect.
Right, these advanced features, the
Yeah.
precision, the compliance, they don't come cheap. And for smaller hospitals, maybe NGOs, especially in resource-constrained places, that upfront investment, plus keeping it running, it can just be prohibitive.
So it's a barrier.
It's a major financial barrier. It definitely slows down adoption and can widen those health equity gaps, often in the regions that need it most.
So accessibility is still a really big issue, especially for those who might benefit most.
Precisely. Then secondly, there's a critical issue around, well, just awareness,
Mm.
especially in developing nations.
Lack of awareness.
Yeah, in many rural or underserved areas, the whole concept of donor milk and why pasteurization is so vital, it just isn't widely understood yet.
Why is that?
It could be a mix of things. Maybe cultural hesitancy, sometimes a lack of targeted education, or simply underdeveloped healthcare infrastructure. Without really robust outreach and education, huge parts of the potential market remain untapped.
So even if the tech exists, people might not know about it or trust it.
Exactly. It highlights the need for education alongside the technology.
That's a really important point. Okay, so you get past the cost, you build awareness. What about actually using the milk? How complex is it to make sure it consistently meets the incredibly high safety standards needed for these vulnerable infants?
Well, that brings us to the third major hurdle,
Mm.
the sheer complexity of regulatory and safety compliance.
Ah, the red tape.
Kind of, yeah. Breast milk pasteurizers have to navigate this intricate web of standards. You've got global ones, like from the WHO, maybe the FDA in the US, but also local national standards from ministries of health.
Wow.
For the manufacturers, trying to meet all these diverse, sometimes changing requirements, it can lead to real delays in getting certified. It definitely adds to the R&D costs, the approval processes. It could be a barrier to entry for new players, too.
So it makes it harder to innovate or get new tech out there quickly.
It can, yes. In healthcare, where precision and documented safety are absolutely non-negotiable, you have to navigate these hurdles very carefully. It's all about trust and patient safety, ultimately.
Okay, so we've laid out the huge need, the drivers, but also these very real hurdles: cost, awareness, regulation. But challenges often spark innovation, right? So how are people trying to move forward? What does the future look like for safe donor milk?
The future actually holds some very promising trends. I think one of the most exciting developments is the integration of much better digital monitoring and traceability.
Okay, tell me more.
So cutting-edge pasteurizers are starting to use things like RFID tagging, detailed batch tracking, basically monitoring every single drop of donor milk, from the source through pasteurization all the way to the infant who receives it.
Wow, like a chain of custody.
Exactly like that, an immutable digital chain of custody.
Yeah.
It's not just about accountability, though it helps with that. It ensures compliance, provides total transparency. You know exactly what happened to that milk at every stage.
That sounds like a fundamental shift, a game changer for safety and trust.
It really is. And another exciting trend is the rise of portable, maybe even home use pasteurizers.
Portable, really?
Yeah, manufacturers are realizing that community donors and these more informal milk sharing networks are playing a growing role. They can seriously expand the available supply.
Right, beyond just the official milk banks.
Exactly. So they're developing smaller, hopefully more affordable pasteurizers designed for these non-clinical settings. This kind of innovation could genuinely unlock entirely new market segments. It extends the reach way beyond hospital walls, right into communities.
So a more decentralized, community-focused approach, potentially. That's interesting. How does the wider system, healthcare, governments, how do they fit into this expanding picture?
Well, if we connect this to the bigger picture, we're definitely seeing an uptick in public-private partnerships. Governments, NGOs, the pasteurizer manufacturers themselves, they're starting to collaborate more effectively.
What are they collaborating on?
It's not just about dropping off equipment. These partnerships aim to provide training for staff, help fund the equipment purchases, and crucially, implement robust safety standards across the board. They're trying to lay the groundwork for a more uh, robust, standardized, and inclusive pasteurization infrastructure.
Which sounds especially vital in those middle income and developing nations you mentioned.
Absolutely critical there, yes. Where the need is huge, but the existing infrastructure might be lacking.
Mm.
These partnerships could be key. So, in summary, the global breast milk pasteurizer market, it's rapidly evolving. It's becoming this truly critical component of neonatal and maternal health care everywhere. And yes, challenges like cost and regulatory complexity, they're still there, they persist. But the driving forces, the tech innovation, the institutional backing, the digital integration, they're really paving the way for steady and I think very meaningful growth.
Right.
The essential role of safe, efficient pasteurization, it's only going to become more vital as more people, more systems recognize the life-saving potential of donor milk.
Hmm.
It's transforming it really from a specialized option into more of a global standard of care.
It's truly remarkable when you think about it, how such a precise piece of technology focused on this very specific healthcare need can have such a monumental, truly global impact, especially on most vulnerable among us. It really makes you consider what other niche innovations might be out there right now. Things quietly transforming lives that maybe we aren't even aware of yet. What hidden technologies are maybe on the cusp of becoming foundational for a better future? Makes you think.